Okay, hello, welcome back to the Oral Health Podcast. So because November is Mouth Cancer Action Month, a campaign that we run to raise awareness of mouth cancer, basically to help people spot the early signs and make sure that they are fully informed of the risks and the symptoms to look out for. We do a mouth cancer report every year, and we're just going to have a little bit of a chat about some of the things that were found in this report and basically just unpack it a little bit. So obviously Karen's with me. How are you, Karen?
I'm good, thank you.
Good.
A big month for us, big month for the Mouth Cancer Action Month campaign. It's always a good one to try and raise awareness and hopefully help people, because it's more and more in the news, and we just find so many people aren't aware of it, aren't aware what to look for, and we need to raise awareness.
Absolutely. And obviously the cases unfortunately are rising. So we had a little bit of a look at years past with our mouth cancer report. And so in 2021, there were over 9,000 cases of mouth cancer. And compare that to 1995, there was only just over 3,000. So it's a huge jump in 26 years. Mm-hmm. Just think 3 times the amount of cases are what we're seeing now.
Yeah, and trends are looking like it's going to continue to increase unless we do something about it. That increase is going to happen year on year, as we've seen in every year. And we look at the statistics, and the rise is far more than any other cancer that I can think of. It's now beating breast cancer and bowel cancer combined, I believe, which is quite a scary number.
Absolutely. Yeah. And not only is it the numbers going up, but when these cases are found, they're often found when they're in their late stages. I mean, most of the cases are found when the cancer's already at stage 4.
Yes, and I think that's partly because people don't recognise the symptoms, and they perhaps seek advice later on. It is more and more difficult to get in to see a dentist these days, but if you were seeing a dentist regularly, they will pick up on any changes in the mouth. They will ask you if you've noticed any changes. So that's the importance of having a regular relationship with your dentist. So many people think, I don't need to go for a checkup because I've got nothing wrong. Your dentist is actually checking for changes in your mouth to see if there is any sign of anything suspicious, and then they would be referring you to have it checked, in which case you would, if it was sort of the worst case scenario, you would be picked up at a much earlier stage, which makes it far less complex to deal with if it's caught early.
Mm-hmm. Absolutely. I mean, going to the dentist is one of the key ways to spot the symptoms early, because they are trained on how to look for it. But obviously there's things that you can look for when you're at home. We're going to go over the signs and symptoms in much more detail in a later podcast. But if really quickly, the main ones, lumps and bumps.
Yeah. Red or white patches, ulcers, anything that hasn't healed in your mouth within 3 weeks. Mm-hmm. Just go and get it checked out. If you haven't got a regular dentist, or you can't get in to see the dentist because
for whatever
reason, go to your GP, tell them what you are worried about. I would expect them, although they're not particularly trained to notice things in the mouth such as that, but GPs will know the etiquette. Mm-hmm. You refer. If there's something in somebody's mouth that hasn't healed within 3 weeks, you refer them.
Yeah.
The specialist would rather have 50 people referred for, an ulcer that hasn't healed, that isn't a suspicious sign, just to catch the one person.
Yeah.
It's much, much better. Nobody's going to say, let's just leave it a little bit longer and see what happens. The referral will be done. It will be normally a fast track referral if any of your sort of dental or medical specialists or professionals are worried, they will refer you quickly.
It's usually a 2-week referral,
It's
isn't
normally
it?
a 2-week referral, yes. And, you know, they might biopsy, do blood tests, maybe do some scans. It will vary on what they think they've found. So any of those, plus a constant hoarseness of your voice, inability to stick your tongue out straight, and as you say, any lumps or bumps. But we will include the neck in that as well.
Absolutely.
And no, although we're talking sort of mouth cancer, we are talking about anywhere sort of really from your shoulders up. You know, head and neck cancers are part of the mouth, although we're sort of concentrate mainly on sort of the oral cavity. They're all part of the same family.
Absolutely, yeah. So a lot of the people that we tend to get that come forward as ambassadors are tongue cancer patients, especially the people we've spoke to this year. I think the majority of them were tongue cancer. But actually, when we look at the data, tonsil cancer jumps leaps and bounds ahead of all of the others in terms of diagnosis. And that's quite interesting to me, because I've not actually spoke to anybody with tonsil cancer before. It's always been either tongue, jaw, lip,
yes, and I think that's
palate.
It's possibly because the people with tonsil cancer will refer to it as head and neck cancer rather than mouth cancer. So they may, if they've been told it's head and neck cancer, and we talk about mouth cancer, they may not think that, you know, the tonsil's part of the mouth. They think of it in the neck.
Yeah.
I think there's a fine line between, isn't there? But if they don't think that it's the kind of cancer that we are dealing with, so to speak, they may not come forward for that reason. But certainly it is the most common.
And that could be, you know, there are very smart people that can pinpoint what has actually caused a cancer, and when cancers are HPV related, they tend to be more in the back of the mouth and in the tonsil. So this just, to me, it makes a lot of sense seeing the data, because we know that HPV is on the up. It is causing much more mouth cancer diagnoses. 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 So yeah, it's causing a lot more. Now it just sounds weird. A lot more cases, HPV related. So to see the increase in cancer in the tonsils makes a little bit of sense.
It does
to me.
make sense. It does make sense. Yes, the HPV virus tends to be tonsils or the back of the tongue. That tends to be where you get it. And HPV is the rising culprit of mouth cancer. It's not overtaken smoking and drinking yet, but it's not far off, and it's growing at a faster rate than smoking and drinking. So I think people might have the awareness of smoking and drinking. We know that smoking's not good for us. We know that it causes all sorts of diseases. Many people don't know that it causes mouth cancer, but you know, smoking is going down, thankfully, and obviously with some new proposed government changes in legislation, the aim is to have 5% of the population smoking by 2030. So that's the aim, is to cut it to that. So that is quite a big ask, but as that happens, we would like to see a drop in the smoking caused, the tobacco caused mouth cancers. And alcohol again is one of those. I think I don't know, people just seem to be less dependent on alcohol, or I don't know whether it's still as socially. I'm not sure whether there's been a drop. I don't know any figures on the consumption of alcohol.
Neither do I, but I mean, there was less binge partying, drinking and stuff through COVID.
Exactly, yeah.
So,
I wonder if that will show in the figures. We don't know yet, because obviously it's not far enough past. Feels like yesterday, but you know, it's we might find a difference, but also we might find a rise because people couldn't get in to see their dentist. So I think it's going to be swings and roundabouts. I think what we're going to gain with one hand, we're probably going to lose by the other. But yes, it's changing slightly because we look at certain age groups and men over 40 who smoke and drink. People used to say, right, that I'm not in that category, so I can't possibly have it. But although many cases are still over 60s, we are finding a really big cohort of much younger people. And many of our ambassadors are not in the demographic that we would ever put them in a risk group, and you know, as young as 23, 24.
It's shocking. And I mean, Charlotte and Laura, who shared their stories on the podcast last year, were both very young when they got diagnosed. Joe, who is a new ambassador, you'll hear his story later on through the month. He was 26, had 0 risk factors. You know, when you see the way that this condition affects people, it just makes you want to shake people and just say, you know, you might not be an over 60s male who smokes a pipe every day, but you're not immune from this.
No, and I think, as I say, it was always classed as an older man's condition, and we're finding, you know, that isn't the case anymore. And when you see, and obviously our ambassadors talk far better about this than we can, because we can only look at reports and statistics and numbers, whereas they have such personal stories about, you know, what has happened, how they were diagnosed, the treatment, the recovery, and the effects that it's had personally on them. And you know, I've always said it's one of the only cancers that people can see that you've had by looking at you. Head and neck cancer, mouth cancer, they all, any kind of surgery is potentially going to be either visible, audible, or it's going to affect the way that somebody eats. So you're always going to be able to notice that there's something. You may not be able to go, oh, well, that person's had mouth cancer, but there is going to be something different to how they were before. And you know, whilst other cancers are very serious, and if you have something removed that's inside or under your clothes, nobody's going to know unless you tell them. So it is a particularly difficult cancer for the person that's had it and the family. And obviously we are now looking at a lot of PTSD from not only the diagnosis and treatment, but what happens afterwards as well. So it's something that, again, we need to sort of almost add that as a risk, if you like. So, you know, we know that mouth cancer has physical effects, but it has emotional effects as well. And it's long, it sort of spreads out across your friends and family, which makes it very difficult and, you know, difficult to deal with.
Yeah, 100%. And, you know, we're going to get a little bit more into all of that later on in the month. And so we're going to leave that here for now. If you want to read more about the State of Mouth Cancer Report, all the statistics and cases and information will be available on our website. Or get in touch if there's something in particular you want to know. I'm sure we'll be able to tell you, or at least point you to where it is that data exists. Have a look out on social media, as always, for more info about the campaign. Mouthcancer.org on Twitter and Facebook. We'll just stick to Instagram at Oral Health Foundation. We've only got the one. It's fine. So yeah, please keep coming back through the month, because we're going to have lots of interesting discussions with professionals and patients to really give you a more rounded view of what mouth cancer, the impact mouth cancer has, and it will be some very interesting conversations. So me and Karen will see you in a few days where we're going to talk a little bit more about the risks.